Okay, game ready. Hello everyone, my name is Christine and I will be performing a bed bath for my return demonstration. So the first thing that you need to do is to check for the patient's chart, to check for the patient's mobility if there had any limitations. And then number two is to gather all my equipments. In this case, I have all my equipment needed for the bed bath return demonstration, and to use the washcloth, warm water, and some cleanser, and at the same time for my hand hygiene as well. And third is to perform hand hygiene. In this case, I will sanitize myself and then identify the client by asking, what is your name, ma'am? So, as I've told earlier, I'll be performing a bed bath, which includes me rinsing and washing your body. Well, I'll be exposing some body parts of yours. So, if you may give me the permission, is it okay? Okay. So, next is I will be providing our patient some privacy by closing the curtains or closing the door. Make sure that the patient has a personal space. Number 6 is to remove compressions such as stockings, any parts of the body, so that we can assess. Okay, in this case, the patient doesn't have any stockings at all. To assess if there's any physical things to notice. Next is to offer the bedpan or urinal. Would you like to use bedpan or urinal? Not? Okay. The reason that we're doing this is that to prevent any disruption when we're performing the bed bath itself. Next is to put on gloves. Let me put on gloves before we begin. Okay. And then I will adjust also the bed height for my liking, for my comfortable position. And then I will be using the side rail as well, especially to the area that I am not cleaning, so that we can promote the patient's safety and comfort as well. So after that is we will remove the top linen. So let me position you. Are you comfortable, ma'am? Okay, let me remove the top linen first. And then I will be putting this blanket. We have this bath blanket or a towel, and then put this here. So since we're gonna start from the first part, and that is the face, I'll be using this clean washcloth. And then with the use of my basin, I have this warm water. And then make sure to drip it, but do not put some soap. And then starting with the eye, from the inner to the outer canthus, same thing with the other. And then from the nose as well. Okay, in this case, we can put some cleanser. But in preference, we don't have to put some cleanser because it will irritate the patient's skin, especially for the face. So from the nose, and then also the cheek and the face, up until to the ear. Okay, so we will use the other side for rinsing. Okay, dip some water again, and then put it to the patient's eye again, and then same directions, and then we're done. Next thing that we need to do is to for the arms, we'll be using the farthest first. Okay, let me have your arms, ma'am, right here. So this cloth is for the cleansing, for the cleanser, for the soap, and this one is for washing. So this shouldn't have any water on it. This shouldn't have any soap on it. Okay, so that is for cleanser. So let me just first cleanse it with water. Let me start with the farthest arm. Farthest arm first. Have your arm, ma'am. Then roll up the sleeve up until the axillary. Why we're doing this? Because we don't want to contaminate the clean arm near us by starting with the farthest arm first. So after cleansing, let us put some cleanser on it or soap, and then up until here, and then at the back as well, and then the arms. And then make sure not to dip this with water. And then using the cleanser, the rinser soap, let us rinse again. Okay, same thing process. And then the next thing that we need to do is to dry it, pat dry slowly. Again, moving on to the near arm. Let's do this fast. So rinse. Okay, rinse up until the axilla, and then using the cleanser up until the axilla as well, and then again, rinse. So the next thing that we need to do is for the chest area. So make sure to lower this so that you can expose the chest area. And same thing that we need to do is that to rinse. Make sure to start with the neck, the bottom part of the neck, up until the breast before before the abdomen. So especially the corner parts of the breast of the patient, and then also add the cleanser, and then rinse with the water. Okay. Next is for the abdomen. Make sure to pat dry using the towel, and then you can fold this and then expose the abdomen. Same thing that we need to do is to rinse first. Rinse with the use of this, and then use the cleanser, and then rinse again. And make sure to pat dry. Okay? Same thing that you need to do for the leg part. For the leg part, let me just expose a little bit up until the feet. So let us start with the farthest. Make sure to cover the other part of the leg. And that same thing is to rinse first, and then to put some the soap. Same thing up until the foot. And we're using warm water to have good circulation. So first this, the cleanser, and then the cleanser, and then rinse, and make sure to use this one, the bath, and put the patient's top linen. Okay, and then make sure to pat dry. Okay, and then once doing this, we're moving to the nearest, or the near foot and leg. Expose this. Same thing that you need to do. Rinse first, then the cleanser, then pat dry up until the foot, and then cover. So once we're done, let us move the patient side so that we can clean for the perineal area and the buttocks as well, and also the back. So ma'am, I would like you to hold on the rail. Imagine there's a rail. Okay, and then let me help you go side to side on 3, 2, 1. Okay. So what we need to do right here is that we will provide our patient some privacy. Let us just expose the areas that we need to clean. Starting with the back first. For the back, I have to use the rinser again, and then rinse, and also the cleanser, and then rinse, then pat dry, and make sure to cover it immediately to prevent having the patient some cold. Then for the buttocks and the perineal area, let me clean my water, or let me change my water. So in that case, just imagine that I've cleaned already. Same thing that you need to do from the cleanest to the dirtiest part, from the outer to the inner. Okay, and then using the cleanser as well, or the soap. You're doing okay, ma'am? You're doing good? Okay, so same thing. We'll pat dry a bit. Same thing to the perineal area, and then we'll ask the patient to face us. So after doing so, after with the buttocks, then we're doing for the perineal area, for the pubic area now. So for the pubic area, ask the patient to go facing you so that it will provide some privacy. Ma'am, can you please move on this side rail as well, and then make sure to provide privacy. Okay, so same thing. We need to change this basin as well, water, and change our gloves since we're handling the perineal area. So change gloves, make sure to dispose. So we're doing this so that it will prevent the cross-contamination, especially this is the most sensitive part of the human body, especially with our patient. So make sure to wear the gloves and change your water. Might as well much better to change the washcloth as well. And then same thing that you need to do. First thing is to use the rinse cloth, and then rinse the perineal area, and then use the cleanser cloth. Put some cleanser, new cleanser, and then cleanse. After cleansing, of course, we have to rinse. In this case, we have to rinse so thoroughly, so we have to use the other side of the rinse cloth as well. And then we can fold Then once we're done, officially done, do not forget to pat dry using our cloth. Okay, pat dry. And then make sure to cover the patient. Okay, ma'am, you can now move on to your original position comfortably. So, do you feel cold? Do you feel cold? Not at all. So, let me just discard my patient's towel right over here. And then also to help the patient in a comfortable position and also adjust the linens. Okay, to prevent some cold. And some people changes their patient's linens, but in this case, I don't have to do it now because it didn't really soil that much. Once we're done, let us move with the, after positioning our patient, let us move with the upper care part. So upper care part is mainly for the hair. So for this, we cannot really rinse the patient's head or the patient's hair, but we can use the rinser or the rinse soap. So just have to rinse with the use of our rinser. So moving on to the area or the hair area, make sure to have my gloves on. So same thing, we cannot really fully wash the patient's head with the use of full water. So we have to use the cloth as well for the rinse cloth. Make sure to focus on the scalp. So focusing on the scalp right here, make sure to thoroughly up. And then let us put the top part first. And then we will not use the cleanser that much. You can use the cleanser, cleanser's cloth, but make sure not to have so much soap on it. So use the cleanser, not too much soap. We can rinse and then put it on the hair, then the scalp, for this, especially for the sweat of our patient, and then up until down to the hair. Then same thing is we have to rinse. Make sure that the patient is comfortable while doing this and will not have any of her hair tangled. So, and then ask the patient to slightly lift her head. You lift your head so that we can focus on the back part. Lift her head. And then rinse the scalp of the back part up until down. Okay, and then put the rinser cloth down and then use the cleanser for the hair and the back part of the scalp underneath as well, and then cleanse. So while doing this, make sure to have our towel ready and pat dry. Okay, once semi-dry, we can now discard our towel again and right over here. And then also to help the patient in a comfortable position and also adjust the linens. Okay, to prevent some cold. And some people changes their patient's linens, but in this case, I don't have to do it now because it didn't really soil that much. So we have to just remain as is. So remove gloves after positioning the patient, perform hand hygiene, and then we can now move the patient's bed to its original position as well. So we're done. That is all about the bed bath.